Hi, everyone, and welcome to today's live stream of 33 and Out. I'm Gina Kim, guest co-host today, and we're going to stick to a 33-minute live stream. Here, let me just see if I can get this up right here. I don't know if you can hear. Check that out. We're going to try and stick to that time frame where we cover the top 33 progressive battles our campaign is fighting to finally put an end to the 33-year long reign of Speaker Pelosi's corporatist agenda. So a good part of the reason we have this live stream is so that we can get a lot of your real-time questions and engagement, and we'll be looking more for your tough questions today. But we also want to highlight a comment that we received last week. John, if we can bring that comment up, from Christine Cassis. So these visuals are great. Love the new format of the live stream, and I'm hoping you do these kinds of visuals with other issues like M4A or GND. Well, thank you so much, Christine, for tweeting that out. And I know that we will be covering a Green New Deal very soon, but today our focus is going to be on Medicare for all. And we've got two great interviews lined up for you today. The first is from a local PhD student at UC Berkeley, Abrar Abidi, who has helped start the mutual aid group, Common Humanity Collective, that's providing hand sanitizers and masks to San Franciscans that are most in need. Following that, we'll have our live interview with Michael Lighty, great guest. You'll really enjoy that one, who most recently was the healthcare director for the Bernie Sanders campaign. And now, without further ado, let's get our next representative of San Francisco's California's District 12 to join us, Shahed. Shahed, how are you?
So good to be with you, Gina. Thanks so much for the introduction.
No, it's great to be here with you as well. And I know that you're going to give some shout outs right now for our super volunteers. Yeah. And then I think you're going to give some of your thoughts on all of the tragic events of that happened this week, including Minnesota.
Yeah. So just first to shout out some volunteers. I want to appreciate some people who've really been fueling our campaign and putting in a lot of time to extend the effort. So first, our interns, Jimena, Mose, Henry, and Zach. We have a new core volunteer, Abads. Natasha P. from Virginia. Joining us from New Haven, Connecticut, Holly S. Here in San Francisco, Nicholas K. Jenna in Stockton, California. And then on the social media team, I want to shout out a few particular super vols. Carolina, who's been particularly active with us on Twitter. Linus, who's been particularly active with us on Facebook. Dave, who just returned to the States from the Peace Corps, who's been really active on Twitter, as well as Daniel S. here in San Francisco. Particular shout out to John P. in Seattle, who's been quarterbacking a lot of the new social media content generation pipeline. Lots of opportunities there. So if you're interested in phone banking with us, if you're interested in the social media side, lots of chances to plug in. We'll get to that in just a little bit. Back to you, Gina.
Great. Yeah, so Shahed, I'd love to hear your thoughts on some of the events that have happened this week. I know it's been a tragic week, starting on Memorial Day to wake up to everything that's been happening. I mean, we have COVID, and another thing is just this rampant racism. So we'd love to get your thoughts on what happened in Minnesota.
Yeah, so police murders are not only unfortunate, they are unacceptable. And posted a video about this a few days ago, talking particularly about two of the points in our 20-point criminal justice reform platform, including particularly the creation of a national registry of killer cops to make sure that when a police officer kills someone, they don't just get rehired by another police department if we are so fortunate for them to be fired from their first position. And I want to make clear here, firing cops is not enough by a long shot. We need to prosecute them, and our 20-point criminal justice reform platform also includes measures to change the law to make it easier to hold cops accountable for state violence, particularly by revising the qualified immunity doctrine that has allowed courts to basically ignore claims of everything from racial profiling to police brutality confronting police officers. That's just one part of the problem, and Minnesota is just one piece of the issue. I'm also reminded particularly of Amy Cooper and her racial demagoguery in New York City, and it reflects a pernicious problem that extends beyond police violence. Racism in America is both institutional and it is cultural, and we have to fix it on both fronts. Our criminal justice reform platform is a solution for one piece of it, the institutional part of the racial bias that infects our criminal justice system. It's one reason I'm eager to replace Pelosi, to make sure that we can change the law, to make sure both that civil rights are respected and that when police officers exceed their authorities, that they are held accountable, including with prosecution and jail time where appropriate.
Thank you so much, Shahed. Yeah, that's a really important piece. I know a lot of people are really emphasizing that we need to see prosecution. It's not enough just to put these guys, whether on admin leave or just fire them. We need more action. So I'm really looking forward to seeing you in office and really making some significant changes. So as always, our first question of the week, exactly who does the speaker speak for, Shahed?
I think the speaker speaks for the 0.1%. A few people I know she does not speak for include George Floyd, who met an untimely demise in Minnesota this week. I know she doesn't speak for the legions of young people that are dealing with the student debt, the crisis around which we discussed in a prior episode. And I know that she doesn't speak for the very soon to be 100,000 Americans who've died from a preventable pandemic. And I'm really disturbed, particularly that our institutions still haven't heeded reason with respect to universal healthcare. We'll be talking about that here today. I'm excited particularly about Michael Lighty, who's going to be joining us. Michael's organized and advocated and developed policy for single payer Medicare for all healthcare nationally, as well as here in California. Most recently, he was the healthcare constituency director for Bernie 2020, and he was previously the director of public policy for National Nurses United and the California Nurses Association. I'm super excited to be joined by Michael Lighty. Welcome, Michael.
Oh, I'm sorry. Well, we don't have Michael yet, but what Shahed, what we have next is we'd love to get your presentation. Great. Thank you.
Hi, Michael. Are you with us?
Yes, I am. Thank you, Shahed. Thank you, Gina. Great to see you all.
Yes, great to see you as well.
Thanks so much for joining us. Maybe do you want to talk a little bit about how the pandemic has impacted the debate around healthcare and how it hopefully has created some opportunities for sanity in this arena?
Well, I think it's profound, actually, because it really has brought to the fore the insecurity that people in this country feel when it comes to employment-based insurance, and also the fragmentation and inadequacy of our present healthcare system. You essentially have a corporate industry substituting for a public health system. That means public health is underfunded. It means things like crucial supplies are not available because of the financing model. Those are expenses, those are costs that hospitals don't want to maintain on the books. And at the same time, when you've got 30 million people losing a job, at least 9 million losing health insurance, you realize that employment-based insurance does not provide the level of security that we need. And so I think all these issues have really pointed to the need for Medicare for all. And you've seen that in the polling. You've seen a 9% increase in support, overwhelming support, 90% among Democrats. I'm certain that that level of close to that level of support exists in CD 12. So I really do believe this is a moment where the pandemic is opening up political possibilities to actually win Medicare for all.
I certainly hope so. And you mentioned CD 12, which at the moment is represented by House Speaker Nancy Pelosi. Is there anything that you might share with our audience about Pelosi's role in the healthcare debate and where she's shown up with her formidable influence in Washington?
Well, I think that Speaker Pelosi is actually one of the major obstacles to winning Medicare for all. She has consistently said, oh, that's, maybe at one time I supported it, or that's a good idea. But her policy approach has been exemplified by what's contained in the HEROES Act, which is essentially a bailout for the insurance industry. And she received the Democratic Congressional Campaign Committee, which funds the campaigns that she cares most about, took $800,000 from the health insurance industry just in a few weeks prior to her unveiling of that provision. So quite frankly, her leadership plays to the most corporatist elements of the Democratic caucus. And on this issue, she has been perhaps the major obstacle for reform. And I don't think that at this point we're going to see the kind of action that we need during the pandemic. We haven't seen it yet from the House, and I don't think we're going to see it as a result of the role she's playing.
Actually, can I interrupt the both of you? Michael, that's an interesting point. We have a great little clip of Reverend Barber really making a call out to Pelosi. And John, I don't know if we can play that quick clip, and we'd love to get your thoughts, both you, Shahed, and Michael.
Absolutely. Mutual aid is, it's an old idea, but it's a word that many of us were not familiar with until the COVID pandemic, when many of these groups emerged. And really the idea is that it's something very much bottom up, unlike many.
We don't need Democrats saying that they can't even fight before that something can't be before they even fight for it. I have great respect for Speaker Pelosi. I believe she's been summoned by history, but this past week when she was asked, you don't expect me, she was asked about health care, and she said, you don't expect me to change the health care system in the middle of a pandemic. Yes, 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 we actually do. We actually do. Mercy says you would, because when did we change slavery? In the middle of the Civil War. When did we change Jim Crow? In the middle of Jim Crow. When did we change Social Security? In the middle of the Great Depression. You change things when they need to be changed. And right now, we need to change from this unmerciful approach to public policy to mercy. We don't need compromise, we need mercy.
Yeah, thank you. Thanks for playing that clip, John. And I just want to thank the audience here for your patience as we work through our live stream. I mean, we really depend on your viewership, so we really appreciate it. But back to you, Michael and Shahed. I know Reverend Barber is super passionate about this, and he says you don't expect me, like to Pelosi says, you don't expect me to change the healthcare system in the middle of a pandemic. And Barber emphatically is like, yes, we do. So I just love to get your thoughts.
Yeah,
on all
Michael,
that.
anything you want to add there?
Well, what I think is so important is that it is exactly that kind of leadership that Reverend Barber demonstrates that we lack in members of Congress, frankly, and certainly in the congressional leadership. There are great members of Congress who really bring that moral perspective, but they're not in charge. And I think we really need that moral perspective and that clear demand. If you can't change a crucial social system like healthcare during the pandemic when it's most needed, when are you going to change it? That was not FDR's perspective on unemployment. They moved to a public employment system through the Works Progress Administration because people are out of work. We need to move to a Medicare for all system because people do not have healthcare security. And if you do not do that, if you do not make big changes at moments when they're most needed, then why are you there? That is, I think, the legitimate question to ask.
I agree with you. And I would describe this to some extent as a failure of leadership. There we are seeing demonstrated not only by a criminal president who is frankly failing to show up for work at all, but also by his enablers in Congress, including some very unfortunately positioned in senior positions in the Democratic Party. And when you talk about the moral clarity that we are lacking among policymakers, I'm very proud to have joined Poor People's campaign events with Dr. Barber when he was here in town in San Francisco, and to have amplified and promoted the campaign on which he and his allies are working. I recognize very much that the need for the systemic changes that we're discussing here today, they might be ones that we would love the luxury of doing in a time of relative calm. And just to be clear, we all proposed these things before the pandemic, and the longer we delay, the more Americans will end up meeting untimely demises. Among the things I've heard you say, Michael, is that when we move to universal health care, it will not only drive down aggregate costs, but it will particularly enhance the public health outcomes because people will have better access and exposure to preventive care. The pandemic reveals in particular, it seems to me, the inadequacy of a pricing framework that treats healthcare as if it were a commodity good with no externalities, as if, you can go to the hospital and, you buy your medicine or pay for your doctor's time in the same way you would like a ham sandwich or something. right? But the issue of precisely is that we all share an interest in each other's access to healthcare, because in an age of contagious pandemic, if you can't get healthcare, it puts me and my family at risk. Is there anything that you see shifting in terms of the debate to acknowledge what economists would recognize as an externality implicit in healthcare, and the nature of healthcare as a public good as opposed to a private commodity?
I think absolutely there is. You've got, just as you say, the healthcare system is really not a system at all. It's an industry. And so the industry is driven by market imperatives that turn our health literally into a commodity. And we are not in a system that really where we're able to fulfill our own destiny, our own life desires, because we're constrained. Two-thirds of Americans by age of 65 have 2 or more chronic conditions. Guess what are the biggest comorbidity factors for COVID-19? Chronic conditions. What's the greatest expense in healthcare? Chronic conditions. That's a direct result of the kind of industry we have. I think too that the sense of taking care of each other, that's at the heart really of what we're asking. Why do you social distance? Why do you wear a mask? You do that to protect others. That sense of caring for each other, solidarity. That's what a healthcare system is for. It's not just to treat disease, it's to prevent it and to take care of each other. And I believe that there is a lot of that going on because of the pandemic, a lot more of that going on, that sense of solidarity and caring for each other. I also think that there are exposures to the failures of the market commodification of healthcare, if you will. Hospitals are having to lay off staff. 1,200 staffers losing their jobs recently announced in one healthcare system. That's because no one's going to get healthcare. Well, that's a silly way to finance healthcare. You go to the doctor and then the insurance company pays. No, you want to provide the resources for those healthcare facilities, doctors' offices, caregivers, nursing homes, so that they are able to be there when we need them. That's a public good, as you say. That's a public health system, and we don't fund it. And we do have to lay this at the doorstep of the Trump administration. They proposed cutting the public health budgets. They've tried to cut the Centers for Disease Control. They have obviously favored the insurance industry and pharmaceutical companies at the expense of workers and our healthcare needs. So I do believe that the pandemic challenges that at a moral level. I think it challenges it at a policy level in terms of how we finance healthcare. And those changes are really ultimately going to propel the issue and compel these policymakers to do something that frankly their financial donors don't want them to do. But with leadership such as yours, being an activist, being part of those moral movements that demand this kind of fundamental change based on the values of community and compassion, solidarity and caregiving, that too, combined with our interests, shared interests, is I think going to be crucial to winning.
Absolutely. And I love how you're grounding it in community self-care and the care we can demonstrate for each other, or the viciousness we can display to one another. And it does strike me that, the for-profit predatory so-called healthcare system that we have has operationalized viciousness for far too long. And in the context of a pandemic, that viciousness reveals itself as also indescribably self-harmfully stupid for our civilization as a policy, because it ducks into the punch of a preventable set of problems. We have a question from our audience I want to run by you. So just to set this up, one of the concerns about the Affordable Care Act and Obamacare is just the ways in which it forces people to pay for healthcare on a private market according to the effectively arbitrary pricing whims of health insurance companies. And a lot of people in the last several years have been alarmed as premiums have gone up. If we were to compare what people are paying for now, what do you think a healthy young person should expect to pay per month for a plan in 2021 if there were a public option available through the existing framework? I'm just trying to get a sense of how reasonable would you describe the private insurance premiums and copays and deductibles that people are forced to endure at the moment if they want to get access to care?
Right. Well, we know that the average premium, the average deductible in large employer plans which are really actually the most affordable, is about $1,600 a year. But when you try to actually go buy a policy on the exchange, for example, you're looking at much more than that. You're looking at deductibles of 5,000, 7,000 or more. We also know that a typical insurance plan for an individual worker on average costs about $13,500. 3,300 of which is paid by the worker before they pay deductibles and copays. So certainly Medicare for all would be a fraction of that. It would be basically a percentage of income, and a relatively low percentage of income, maybe 4%. When you're looking at paying, $3,000 a year plus 1,600, you're already at 5,000. And it's reasonable to assume, in fact, that individuals would be much less under Medicare for all. That isn't to say that it's free. This is actually an expression of shared responsibility. It's just much more efficient to pay for it through a public financing mechanism, through taxes. It turns out once you do that, you can eliminate the administrative waste, you can eliminate the profit making, and you can contain prices. Because of course, we're paying too much for prescription drugs. We're paying too much for medical devices. So we're going to have to rein in those outrageous prices. That's what the joke is, why does healthcare in the US cost so much? Because prices are high. And so you need the strength of a single payer, as it were, to lower those prices, but you also need the mechanism of public financing and administration to provide global budgets for hospitals, to provide clinics the resources they need to keep rural hospitals open. Those things simply can't be done through private insurance, because the private insurance imperative is less care means more money for the shareholders and for the execs. And that's also true on the hospital side. We learned one hospital system, Providence Healthcare, pays their CEO $10 million annually. Insurance companies generally pay around $20 million a year for their CEOs. That's absurd, but if they're successful in denying care, then they are rewarded with that kind of salary. And so that's really at the heart of the problem.
That is outrageous, Michael. That is outrageous. I want to interrupt here too, because we have a question for Shahed as well. And then Michael, afterwards, if you want to interject, please do. But Shahed, we have a question from Charles T. of Palo Alto. Shouldn't you be rallying support for the Speaker's HEROES Act as a way to get SNAP and health benefits to people in poverty ASAP?
Yeah, the HEROES Act includes some important components, including relief for state and local governments. Hazard pay for essential workers is a component of it that I'm especially excited by. And, Speaker Pelosi is rallying plenty of support for it. I've been more concerned about the areas of the under-inclusion in the HEROES Act, what it does not include. For instance, any support for rent or mortgage payments, or support for the Paycheck Guarantee Act proposed by Pramila Jayapal. She's the lead sponsor of both the measure that would protect Americans' jobs in a time of unprecedented unemployment, as well as the Medicare for All bill that Speaker Pelosi has impeded from coming to the House floor for a vote. So across each of these contexts, I've seen the progressive vision, the needs of a people struggling to bear the challenges imposed by a public health and economic crisis beyond the likes of which we've ever seen in our lifetimes. And in the face of that, the HEROES Act instead emphasizes bailouts for major corporations. So there are components of it that are useful and necessary. There are a lot of other components in it that reflect Speaker Pelosi's prioritization of corporate interests before those of her constituents. And that's particularly why I'm eager to see the House show up for work and pass a bill that meets the needs of the moment and that meets the needs of, again, an American people who are struggling with a lot of different challenges. We're talking at the moment about Medicare for All as a gold standard, universal health care, regardless of your condition. As if we were to restrict and fall back from that, it might make sense in an age of a contagious pandemic that we would pass free treatment for COVID on an emergency basis, at least. And Speaker Pelosi doesn't support that either. I'm grateful that testing for COVID has been made widely available, and that is at least an improvement over the preceding baseline. But each of the coronavirus stimulus packages that have moved through the House have remained dramatically disappointing, particularly because they have included massive public giveaways for corporate interests instead of the stimulus payments to working families that we need. And in addition to the bailout for corporate lobbyists in the most recent proposal, the one before that included tax breaks of over $1.5 million each for 43,000 tax filers, each of whom were filing income of over $1 million a year. And I think the idea that in the middle of a pandemic, that Speaker Pelosi is more concerned with prioritizing million-dollar tax breaks for millionaires and corporate bailouts, taxpayer-funded corporate bailouts, is, to say the least, problematic. And I'd much rather see the House, and what I look forward to voting for when I am in the House, are measures that would, in the face of a crisis like this, ensure that Americans can keep their jobs and stay in their homes. Those are the most important needs at the moment, not bailing out fossil fuel industry lobbyists.
Thank you, Shahed. Michael, do you have anything to add to that or have any thoughts?
Well, I think there are elements of the HEROES Act that are very, very important. Personal protective equipment for healthcare workers, SNAP, a number of other provisions. But as a political strategy, it strikes me as just kind of a wasted opportunity. I mean, we basically, this is supposed to be an opening bid to the fifth stimulus bill. We should have staked out a position at first when Leader McConnell actually cared about doing something quickly and put our most important stuff forward. We're 2 months plus into this pandemic and our nurses do not have PPE. That, to me, is outrageous. That should have been one of the first things they did, just like SNAP, just like paycheck protection, as Shahed mentioned. And also, the Speaker had an opportunity to do the Healthcare Emergency Guarantee Act that is, again, sponsored by the Medicare for All sponsor, Pramila Jayapal. That would cover everybody's out-of-pocket expenses. It would cover the uninsured, and it would do so simply by billing Medicare. It's cheaper than the healthcare provision that's in the HEROES Act, that doesn't cover people's out-of-pocket expenses, that makes us basically subsidize the private insurance industry. So she's got a cheaper, better proposal that she could have put in the HEROES Act and actually leveraged the Senate Republican majority to guarantee healthcare. She didn't take that opportunity. The HEROES Act is DOA in the Senate. Why do we keep talking about it? Just to make the Democrats look good, or to make us feel like, oh, the House did something? The House did something that was basically defined by what the centrist corporate Democrats were willing to support. But we need to push that from a progressive direction. And that is, I think, a failed negotiating strategy and a failed political strategy to not do that.
Thank you so much, Michael. Michael, we really appreciated having you on the show today and getting your perspectives on all of this. You're
Thanks so
welcome
much.
to stay. We are going to now show the video of an interview that Shahed did with Abrar Abidi, touching upon a little bit of what you spoke about earlier, just shared interests and communities coming together to fill in the gaps where we're lacking resources, and how people are coming together. Or we can say goodbye at this moment. And
well, thank you very much, Gina, and thank you so much, Shahed, and good luck with your campaign. It's been a real pleasure to be a part of this.
Thank you, Michael. So appreciate you joining us and all your advocacy. Keep up the great work.
Thank you.
yes, thank you, Michael. So Shahed, do we have you here?
Yeah, I'm here.
Okay, wonderful. We want to roll this interview that you did, but before we do, I'd love for you to just give the audience a little bit of a context of what this interview that they're about to see.
Yeah, you'll learn about Abrar Abidi. He's a PhD student studying molecular biology at the University of California, Berkeley. And he responded to the pandemic in a way that I found really inspiring, rolling up his sleeves and diving into mutual aid project that has encompassed now communities across the entire Bay Area, not just on his campus, but well beyond it. And yeah, looking forward to sharing with you a little bit of the inspiring mutual aid work happening here in the Bay, undertaken by students and activists responding to the public health crisis.
Absolutely. Mutual aid is, it's an old idea, but it's a word that many of us were not familiar with until the COVID pandemic, when many of these groups emerged. And really the idea is that it's something very much bottom up. Unlike many sort of top-down charities, it relies on a group of ordinary people identifying some need that the government has failed to meet, and a few people coming together and somehow meeting that need. But it also has a critical sort of radical edge to it, because it's also about revealing why that need exists in the first place and evincing the brutalities of American capitalism that create these needs.
That's incredible. I mean, both the vision and the initiative, as well as the scale. I mean, just the sheer fact that you've been doing this now for on the better part of 2 months, if I'm not mistaken, and the distribution's taken place all over the Bay Area from San Francisco to the Deep East Bay, if I'm not mistaken, right?
That's right. And at this point, we've made around 3,000 gallons of sanitizer, which is enough for many, many tens of thousands of people.
And in a time of contagious pandemic, that's literally keeping people alive. So thank you so much for your service to the community. When you were describing the context of mutual aid, you were describing how it not only fills a need, but it also calls out the absence of programs by our institutions to fill that need. And in the context of the pandemic in particular, one of the, in my mind, most glaring omissions is our lack of a universal health program. Do you want to talk at all about healthcare and the need to which your project is responding?
This project might not need to exist if this were a functioning country that, with the enormous wealth that's been generated, might afford citizens, just as a basic human right, healthcare or housing. But clearly, the United States does not guarantee people those things, despite the fact that we're in cities with people, individuals with more wealth than God. And so it is because these basic rights have been deprived, we have to do these spontaneous grassroots operations like this and effectively reveal that it doesn't take much money, it doesn't take too many people to provide people with these tools.
This is a contagious pandemic, meaning that we all have a shared interest in each other's healthcare. It's one reason why I and so many people around the country support universal healthcare, particularly as an emergency response to the current moment. And in the context of the global mounting climate crisis, we see the commitment of so many career politicians, not just in the Republican Party, but unfortunately in Democrats too, who refuse to heed the calls of scientists who have told us for decades that we have to make very sharp, dramatic changes to reduce our carbon emissions, to make transitions to 100% renewable energy.
So long as people like Nancy Pelosi are in office, and she is the standard bearer, the most visible representative of a form of toothless centrism that my generation and the generation below me has rejected. She's someone who has openly decried a Green New Deal and mocked Medicare for all. What scientists are saying are never going to be listened to. And so I think that the race that you're engaged in is right now the most important race in the country, because it's not going to matter what scientists say if people like Nancy Pelosi are still at the helm.
Could not agree more. And I so appreciate your support, particularly as somebody who's done so much on the ground to help our community. I'm reminded of some words about the generation of particularly climate justice activists. You referred to your generation and the ones below you. I'm reminded of having heard Bill McKibben speak here in San Francisco about 6 months ago. And he shared this reflection at the time that stuck with me very poignantly, that the leaders of our society are acting like children. And that becomes even more forceful in the last week, as Nancy Pelosi and Donald Trump are trading schoolyard epithets, that the leaders of our society are acting like children, while the children of our society are acting as the leaders. And you might not be a child, but as a student, seeing you step forward into filling this gap that our institutions have so, again, dramatically failed, for me is very inspiring as someone, on this side of the Bay. Is there anything you want to share about the call to leadership confronting your generation and the Zoomers and the folks, behind you, what this moment in history portends for folks engaging it and embracing it with the future, your future at stake?
I think my generation, the generation below me, can tell the difference between someone who is authentic, someone who is fighting for real, legitimate change, and someone who demonstrates the theatrics of brand resistance. And so it does give me hope that I see people my age, people younger than me, able to tell the difference between these symbolic gestures in people who are actually fighting for the real thing.
Means a lot to me. Thanks, Abrar. See you again soon.
You too. Bye.
Well, thank you, everybody. That's about wrapping up our show here in a moment. But Shahed, before we close, thank you for doing that interview. Do you have any closing thoughts on just the whole, just on Medicare for all, universal healthcare, and Michael Lighty, your interview with him and your interview with Abrar?
Yeah, each of these different, the mutual aid project that Abrar is undertaking demonstrates the very same need that the pandemic brings into sharp focus, and that Michael made really explicit in our interview, and that is to care for one another. That's what we are here to do. That's what public policy should do, is care for our communities and reflect that commitment. And it's exactly because we don't have universal healthcare, the grad students at UC Berkeley are forced into engineering this supply chain pipeline to produce hand sanitizer at scale for unhoused members of and elderly folks in our community. It's the same reason why we have to fight like tooth and nails to get the basic human rights that people in other countries already enjoy. And I'm eager to go to Congress to fight for those rights.
Yeah, no, that's right. I know Abrar did mention something about that these are services that we normally wouldn't need if our government was actually doing their job. We wouldn't have to have students trying to put hand sanitizer together for our communities. So I'm just so thankful for all the citizens out there that are doing their part and just, taking care of one another. But I do have one more question. There are some people who are curious to know, if they're from out of state, how can they support your campaign?
Yeah, our campaign really relies on the efforts of volunteers from around the country. Earlier in our live stream, I had a chance to shout out some of the folks who really differentiated themselves just in terms of the level of commitment that they've demonstrated. Anybody, though, even if you just have an hour, is welcome to sign up at shahid.fyi/volunteer. We'd love to have you. We do online training sessions every other day. Our staff will be really eager to connect with you and answer any questions and put you in a position to help support the campaign. I will say that we only have to cover one city, and we still have 5 months to do it. We've trained hundreds of volunteers so far, and we're training more actively. Again, would love to invite anybody who wants to see Nancy Pelosi replaced by an advocate for single-payer healthcare. Join us again, shahid.fyi/volunteer. And maybe while I'm at it, I'll just say other things you might do include sharing our media hits. Just yesterday, the Washington Post quoted me in a story about challengers to entrenched incumbents. There's a podcast interview and an article in the San Francisco Chronicle from last week. And in the last week, some of the podcasts I've had a chance to join include one hosted by independent journalist Walker Bragman, the Delete This Account podcast. And I was really pleased by a story that ran in Middle East Eye, discussing me in the context of a number of other campaigns that have chosen to put human rights first before the interests of our military-industrial complex.
Thank you so much, Shahed, for another great live stream with you today. It was so wonderful to hear your thoughts on Medicare for All. And until next week, thank you.
Thank you for joining us, Gina.
Yes, thank you so much. And thank you all out there watching us today. Thank you so much for joining us on our second installment of 33 and Out. I know we're really trying hard to stick to the 33-minute format, but we're getting closer. And we look forward to speaking more along our historic journey to unseat the most powerful member of the Democratic Party in the last 75 years. And in case you missed the first installment of why we chose the song that we chose, the Whitney Houston song, it was I Want to Dance with Someone. It was the #1 hit in May of 1987, which was the last time Speaker Pelosi ever felt it necessary to appear on a debate stage to defend her record and convince us why her brand of corporate-dominated government for the 1% is best for us all. So personally, we think a rematch and a remix is long overdue. What do you think? We'd love to have you leave your comments, thoughts, and suggestions down below. Thank you so much. See you next week.